You know that feeling, right? When your dog, who's usually bouncing off the walls, is suddenly just flat. Or your cat, the one who lives for mealtime, barely sniffs their bowl.
Oh, absolutely. That little worry starts in the back of your mind. You just know something's not quite right.
Exactly. And it's that kind of subtle thing that leads us into our deep dive today. We're looking at a condition that can sometimes creep up just like that.
We're talking about Addison's disease. The more technical term is hypoadrenocorticism in dogs and, less commonly, cats.
Right. And we've gone through quite a bit of veterinary medical info, sort of pulled out the key pieces for you.
Our goal really is to cut through the jargon. What is this thing? How does it actually affect pets?
And what are the main things you, listening right now, should really understand about it?
We're going to cover, the basics of what it is, what happens in the body, who gets it, and importantly, how vets figure it out and treat it, based on solid medical sources.
Okay, let's jump in then. Addison's disease. Fundamentally, what are we talking about?
So, at its core, it's an endocrine problem. That means it involves hormones. Specifically, the adrenal glands, these tiny glands near the kidneys, aren't producing enough of certain crucial hormones.
Hormones
Like glucocorticoids, cortisol is the main one most people have heard of, and sometimes mineralocorticoids like aldosterone. And these hormones are like messengers controlling a lot of bodily functions.
Okay. I've seen terms like primary and secondary hypoadrenocorticism thrown around. What's the difference there?
Good question. So primary means the issue is directly in the adrenal glands themselves. They're damaged, maybe destroyed, so they can't make the hormones. Usually both cortisol and aldosterone are low.
And secondary.
Secondary starts higher up, usually in the pituitary gland in the brain. The pituitary makes a hormone called ACTH, which is the signal telling the adrenals to produce cortisol.
Ah, so if the pituitary signal isn't sent.
Exactly. If there's not enough ACTH, the adrenal glands don't get the message, and cortisol production drops. Aldosterone production is usually okay in secondary cases, though.
Then there's atypical Addison's. That sounds confusing.
It can be, yeah. Historically, atypical referred to dogs that definitely had primary adrenal failure, but their electrolytes, sodium and potassium, looked normal on the first blood test.
But they still have the disease.
Yes, and actually more recent understanding suggests many of these atypical dogs do have some degree of mineralocorticoid deficiency. It's just not always obvious on standard tests initially, so the label atypical might be a bit misleading sometimes.
So usually when vets talk about Addison's disease, what specific scenario are they referring to?
Generally, it refers to the primary kind, where both glucocorticoids and mineralocorticoids are deficient. And the most common cause of that is thought to be immune-mediated destruction.
Immune-mediated, meaning the body attacks itself.
Precisely. The immune system mistakenly targets and damages the adrenal glands. We call it idiopathic because we don't know the exact trigger, but that's the suspected mechanism.
Okay, got it. So these hormones are low. Let's break down the impact. What happens when mineralocorticoids, like aldosterone, are deficient?
Aldosterone's main job is balancing sodium and potassium. It tells the kidneys, hold on to sodium, get rid of potassium.
So without enough aldosterone,
The opposite happens. The body loses sodium and potassium levels start to climb. Hyperkalemia, that's high potassium. Hyponatremia is low sodium.
and that sodium-potassium imbalance causes problems, I assume.
Big problems. Losing sodium means water follows it out of the bloodstream, so the circulating blood volume drops. This can cause dehydration, low blood pressure,
Makes sense.
and it can lead to something called prerenal azotemia, basically. Kidney values look high because the kidneys aren't getting enough blood flow. You'll also see weakness, maybe collapse, just general depression.
And the high potassium side of things, what does that do?
High potassium, the hyperkalemia, also causes weakness, lethargy, poor appetite. But the really scary part is its effect on the heart.
How so?
It can cause a dangerously slow heart rate that's bradycardia and other abnormal heart rhythms, arrhythmias. It can be life-threatening.
Wow. Okay, that's serious. Now, what about the other side, the glucocorticoid, the cortisol deficiency? What happens when cortisol is too low?
Cortisol has a ton of jobs. It helps regulate appetite and digestion, for one. So low cortisol often leads to things like poor appetite, maybe anorexia, vomiting, diarrhea.
I see Melina here too, dark stool.
Yes, that's digested blood, usually indicating some bleeding high up in the GI tract, which can happen with low cortisol. Lethargy and weight loss are also really common.
And blood sugar, does cortisol affect that?
It does. Cortisol helps keep blood sugar stable. So without enough cortisol, pets can become hypoglycemic, low blood sugar.
Okay.
And one other thing, it can impair the body's ability to excrete water properly. So just a whole cascade of effects.
It really touches so many systems. So who gets this? Is it common? Are certain pets more at risk?
Overall, it's considered uncommon to rare in dogs and definitely rare in cats.
But I see breed predispositions listed for dogs.
Yes, there are some breeds where we see it more often. Great Danes, Rottweilers, Portuguese water dogs, standard poodles, beardies, Leonbergers, Westies, Tollers, Wheatons, too.
Interesting. Any breeds less likely?
Seems so. Golden Retrievers and Chihuahuas appear to have a lower risk. But importantly, for cats, there's no known breed link.
What about age? Young pets? Old pets?
In dogs, it can happen almost any time. We've seen it from under a year old to over 12. But the average age is around 4 years. So typically young to middle-aged dogs.
Hey, cats.
Usually middle-aged cats, maybe ranging from 1 to 9 years old based on reports.
Any difference between males and females?
In dogs, yes. Female dogs seem to have a higher relative risk than males, but in cats, no sex difference has really been noted.
Okay, so maybe a middle-aged female standard poodle's a classic picture, but really it could be any dog.
Yeah.
And it's very unlikely in cats.
That sums it up pretty well.
Now, for owners listening, what are those subtle clues? The things you might notice at home that could make you think, maybe?
This is key, because the signs, especially early on, or in chronic cases, are just so vague they can easily look like something else, a stomach bug maybe.
But sometimes it hits suddenly.
Yes, an acute Addisonian crisis is dramatic and life-threatening, but often it starts slowly. And because it affects multiple systems, the signs can really vary.
So for dogs, what kind of things might an owner see?
Things like just being more tired, lethargic, loss of appetite, maybe vomiting, weakness that seems to come and go, weight loss you can't explain, diarrhea.
That coming and going thing sounds important.
It really is. That waxing and waning illness pattern is a big clue. Maybe they seemed sick, got some fluids or something generic from the vet, seemed better for a bit, then got sick again.
Right.
Other signs can be shaking, drinking, or urinating more, PUPD we call it, or that dark tarry stool, the melena.
Are the signs similar in cats, those vague ones?
Very similar. Lethargy, poor appetite, weight loss, vomiting, that waxing, waning pattern again. Maybe they seem to get better with fluids or steroids for some other reason in the past. Increased thirst and urination can happen too.
Okay. And when the vet examines the pet, what might they find that adds to the suspicion?
On exam, a dog might just seem really depressed, weak, dehydrated. In bad cases, they might be collapsed.
That's a cool sign.
Yeah, like low body temperature hypothermia, slow capillary refill time, or CRT when you press the gums, the pink color should snap back fast. If it's slow, that suggests poor circulation.
Okay.
Maybe that dark stool again, a weak pulse, a slow heart rate, that bradycardia we mentioned, maybe a painful belly, and sometimes even hair loss if it's been going on a long time.
And for cats being examined?
Pretty similar findings, really. Dehydration, weakness, low temperature, slow CRT, depression, weak pulse, slow heart rate, potentially collapse.
It still sounds like it could be mistaken for a lot of things.
Mm-hmm.
What makes a vet start thinking specifically, could this be Addison's?
You're right, the non-specific nature is the challenge. But that history, the vague, chronic, waxing, waning signs, especially if they improved before with supportive care like fluids or even steroids given for something else, that pattern is a huge red flag.
That history is really critical then.
Absolutely.
Let's circle back to the causes. We mentioned primary and secondary. Can we elaborate on what actually triggers these?
Sure. For primary hypoadrenocorticism, the adrenal glands failing, the most common reason is idiopathic, which, as we said, likely means immune-mediated destruction, the body attacking the glands.
Are there other causes for primary?
Yes, though less common. Things like an overdose of drugs used to treat the opposite condition, Cushing's disease like mitotane or trilostane, also certain infections like fungal disease or cancer spreading to the adrenals or even blood clotting problems within the gland.
Okay. And for secondary hypoadrenocorticism, the pituitary issue?
The most common cause we actually see in practice is iatrogenic, meaning caused by medical treatment. Specifically, stopping long-term steroid medication too quickly. If a pet's been on steroids for a while, their own system stops making as much cortisol. If you just yank the steroids away suddenly...
Body can't cope.
Right. The pituitary hasn't ramped up the ACTH signal yet, so you get a temporary cortisol shortage. That's why vets always taper steroids slowly.
Good reminder. Any other causes for secondary?
Much less common, but things like tumors or damage in the pituitary region that prevent ACTH production, or very rarely a specific defect where only ACTH production is affected.
So always, always taper steroids as prescribed.
Absolutely crucial.
All right, diagnosing this tricky condition, it sounds like putting puzzle pieces together. What are the diagnostic tools?
It definitely is detective work sometimes. That history we keep mentioning is piece number one. The vague signs, the waxing and waning, the response to non-specific treatment.
What about basic blood tests? Do they help narrow it down?
They often provide really important clues. You might see mild anemia, sometimes increases in certain white blood cells, eosinophils, and lymphocytes. But maybe the most significant clue on the basic blood count is the lack of something. A stress leukogram.
What's that?
Normally, when an animal is sick or stressed, their white cell counts change predictably, neutrophils usually go up, lymphocytes go down. That's the stress response, driven partly by cortisol.
Ah, but if they don't have cortisol?
Exactly. They might not show that typical stress pattern, even though they're clearly unwell. Seeing normal or high lymphocytes in a sick dog should definitely make you think about Addison's.
What about the blood chemistry? Electrolytes and other markers?
That's often where we see the classic signs. High potassium, low sodium, that NA-K ratio being off is a hallmark finding.
Anything else?
Yeah, you might also see low chloride, low total CO2 or bicarbonate, high kidney numbers, the azotemia we talked about, maybe high phosphate, high calcium, sometimes elevated liver enzymes or low blood sugar. It's quite a pattern, potentially.
Reflecting those hormone deficiencies we discussed.
Precisely. The lack of aldosterone messes up the sodium and potassium, and the lack of cortisol affects glucose and other things.
And urine tests. What do they show?
Often, the urine is inappropriately dilute. They can't concentrate it well. If they also have high kidney values on blood work, it can sometimes mimic primary kidney failure, which adds to the diagnostic challenge.
So, with all these clues, what's the definitive test? The one that says, yes, it's Addison's.
The gold standard is the ACTH stimulation test. This directly tests how well the adrenal glands can respond when prompted.
How does it work?
We measure the cortisol level in the blood. First, that's the baseline. Then we give an injection of synthetic ACTH, the hormone that normally tells the adrenals to make cortisol.
Like flipping a switch.
Sort of. Then, after a set time, usually an hour, we measure cortisol again. In a healthy pet, cortisol should jump up significantly after the ACTH.
And in a pet with Addison's?
Their baseline cortisol might be low, and crucially, there's very little or no increase after the ACTH injection. The adrenals just can't respond. That confirms the diagnosis of hypoadrenocorticism.
Could you just check a single resting cortisol level instead?
A single low level is suspicious, but not diagnostic on its own. However, if a resting cortisol level is above a certain point, say 2 micrograms per deciliter, in dogs not on recent steroids, it makes Addison's very, very unlikely. It's a good screening tool to potentially rule it out.
But you still need the ACTH stim test to rule it in.
Correct. That's the confirmation.
And how do you tell if it's primary adrenal failure versus secondary pituitary issue?
That's where measuring the ACTH level in the blood plasma itself comes in. Remember, ACTH is the signal from the pituitary.
Right.
So in primary Addison's, the adrenals are failing, so the pituitary is shouting, trying to get them to work. ACTH levels will be high.
Makes sense.
In secondary Addison's, the pituitary isn't sending the signal, so ACTH levels will be low, maybe even undetectable.
Is there a catch?
Yes, you absolutely have to collect that blood sample for ACTH before starting any steroid treatment, as steroids will suppress pituitary ACTH and mess up the test. And sample handling is critical for accuracy.
Okay, what about imaging, like X-rays or ultrasound? Do they play a role?
They can provide supporting evidence, though they aren't the main diagnostic. X-rays might sometimes show a small heart, maybe narrow blood vessels, lungs that look a bit underfilled with blood, sometimes a small liver.
And ultrasound.
Ultrasound lets us look directly at the adrenal glands. In primary Addison's, especially the immune-mediated kind, the adrenal glands are often smaller than normal, atrophied.
So, looking inside, at the tissue level, what's happening in the adrenals themselves?
Grossly, meaning just looking at them, they'd likely appear shrunken, atrophied.
And under the microscope?
In that common immune-mediated form, you'd see signs of the immune attack infiltration by lymphocytes and plasma cells, that's the adrenalitis, or just general shrinkage of the adrenal cortex, the outer layer. If it was caused by something else, like a fungus or tumor, You'd see evidence of that instead.
Okay, so the glands aren't working. Let's talk treatment. How do we help these pets?
First, the acute crisis. If a pet presents collapsed, severely dehydrated, electrolytes way off, that's a true emergency. It needs intensive hospital care.
What does that involve immediately?
Rapid intravenous fluids are number one. Often 0.9% saline is the fluid of choice to help replace sodium and volume. We need to monitor everything closely: hydration, blood pressure, urine output, temperature, heart rhythm, and keep stress minimal.
And once they're past the crisis, or for pets diagnosed before a crisis, what's the long-term plan?
For primary Addisons, it's lifelong hormone replacement. We have to give back the hormones the adrenals aren't making.
Both types, glucocorticoids and mineral corticoids.
Yes, for typical primary Addisons, glucocorticoid replacement is usually daily oral prednisone. The dose is pretty low, just replacing what's missing, maybe 0.1 to 0.2 millikilograms per day, adjusted for the individual.
Any alternatives? Like for cats?
Cats are rarely affected, but yes, options exist. Sometimes a monthly injectable steroid like Depomedrol is used in cats instead of daily pills.
And the mineral corticoid replacement, that sounds crucial for the electrolytes.
It absolutely is. The most common and often preferred way now is a monthly injection of DOCP desoxycorticosterone pivalate. Percortin is a common brand name.
How does that work?
It's a long-acting mineralocorticoid. We figure out the right dose and frequency, usually aiming for about once a month, based on monitoring their sodium and potassium levels. The initial dose for cats is often around 12.5 milligram total.
Is there an oral option for mineralocorticoids?
There is fludrocortisone acetate, brand name Florinef. It's a daily pill, sometimes twice daily. Again, the dose needs careful adjustment based on electrolyte monitoring.
Any differences between DSCP and fludrocortisone?
Fludrocortisone also has some glucocorticoid activity, so pets on it might need less or sometimes no additional prednisone. But potential side effects can include increased drinking, urination, or appetite. DOCP is purely mineralocorticoid.
Going back to that crisis situation, what specific drugs are used right then?
In the crisis, we need fast-acting injectable glucocorticoids immediately. Often dexamethasone sodium phosphate is used because it's potent and, importantly, doesn't interfere with the cortisol measurement if we still need to run the ACTH stim test.
Higher dose initially.
Yes, a higher shock dose intravenously than tapering down. Aggressive fluid therapy is key, like we said. Maybe colloids if blood pressure is very low, dextrose if blood sugar is low, and treatment specifically to lower dangerous potassium levels if needed.
And if it's secondary Addison's?
Then they typically only need the glucocorticoid replacement since their aldosterone production is usually intact.
Okay, so once they're stable and on long-term meds, what does follow-up look like? How often are checks needed?
Monitoring is essential. Initially, while stabilizing, it's very intensive in the hospital. Once they're home on chronic meds, regular electrolyte checks are crucial to fine-tune the mineralocorticoid dose.
How often?
For GOCP, we often check electrolytes about 10-14 days after the first couple of shots, then maybe right before the next shot is due to see how long it's lasting and adjust the dose or frequency. Once stable, maybe every few months, then perhaps every 6 months. It varies.
And for fludrocortisone?
Checks might be more frequent, initially weekly, then monthly, then maybe every 3-12 months once stable. We also monitor kidney values, especially if they were high initially.
So what's the bottom line? What's the long-term outlook for a pet with Addison's?
Honestly, with proper diagnosis and consistent lifelong treatment, the prognosis is generally good to excellent for most cases.
That's really encouraging.
It is. The key is owner compliance with medication and follow-up, and understanding they need to give extra glucocorticoid stress dosing during illness, travel, surgery, things like that.
Are there complications to watch out for?
Sometimes the prednisone or fludrocortisone can cause excessive thirst or urination, which might need dose adjustments or switching meds. DOCP side effects are rare, but can include weight gain or increased thirst urination occasionally.
But overall, they can live pretty normal lives.
Absolutely. Happy, relatively normal lives are the expectation, unless the Addison's is caused by something like metastatic cancer or a pituitary tumor, which have their own prognosis.
Okay, let's sum up the really key takeaways from this deep dive. Addison's disease. It's a lack of essential adrenal hormones.
Right. The signs can be super vague, sneaky, come and go. Don't ignore persistent, non-specific illness.
Diagnosis needs specific testing, especially that ACTH stimulation test. It's not always obvious from routine blood work alone.
And treatment is lifelong hormone replacement, but it's usually very effective. Prognosis is generally great with good management.
So for you listening, the big message is really about being observant, right?
Mhm.
Noticing those subtle changes in energy, appetite, behavior.
Exactly. Trust your intuition. Talk to your vet about any concerns, especially if things just seem off and aren't resolving or keep coming back.
Even though Addison's isn't super common, knowing about it helps you advocate for your pet.
It absolutely does. It empowers you to ask the right questions and be part of the diagnostic process.
It really makes you think, doesn't it? How those little day-to-day changes we see in our pets could sometimes signal something deeper. It's a good reminder to stay curious and always pay close attention to their well-being.